Worrying indeed that Andhra Pradesh has crossed the 5 lakh mark. In fact, for the first time after 12 days, the number of positive cases being reported in one single day was less than 10,000, which means that the last 1 lakh in fact has literally come in 10 days, because every single day for the last 12 days they had been reporting over 10,000 cases. We have been talking about Andhra Pradesh as a state that has always done very high testing. They have done over 41 lakh tests, which works out to more than 75,000 tests per million, which is more than double of the national average itself. Despite such high testing, one would wonder why then is the state reporting such high number of cases and continuing to report high number of cases, because the traditional understanding has been that if you test more, you trace more, you track more, and therefore you are able to control the disease so much more. But in this particular case, it would appear from what we have seen travelling in the districts of Krishna, Prakasam as well as Guntur and also Chittoor district, that social distancing and wearing of masks and certain level of should I say self-discipline on the part of the people seems to be missing, and that's one reason why the chain of transmission perhaps has not been able to be broken. The numbers have been big, the tracing, tracking on the part of the authorities may not have been to the extent that it is possible. So that's one reason why we are seeing very high rates of transmission. Positivity rate itself is 12.18% in Andhra Pradesh, whereas the national recommendation at least is that it should be kept below 5%. In fact, 5 states we are talking about: Maharashtra, Andhra Pradesh, Karnataka, Tamil Nadu and Uttar Pradesh, that are contributing, that have contributed to 60% of the cases in the last 24 hours, but they have also contributed 57% of the recoveries. In the recoveries list itself, Andhra Pradesh is on top with over 11,000 recoveries that are being reported. But what I must point out is one thing positive about Andhra Pradesh is that it has a very good network of ambulances that have been in service. There have been in fact more number of ambulances were brought in as well to deal with the COVID crisis, and they are going around doing the testing as well as taking back patients into isolation, supervised isolation at home as well. That is something that they are doing, and that's one reason perhaps that they have been able to keep the mortality rate to less than 1%. But the isolation of people who are asymptomatic or not, who can be stopped from spreading this virus itself, that seems to have been a little bit of failure in the case of Andhra Pradesh, and that's why we are seeing such high rates. Whereas Karnataka also of course crossed the 4 lakh mark, but there the death rate is very high in Karnataka as well, and that's something that they would need to worry about. If you look at Telangana on the other hand, we have been talking about Telangana as a state that tested very little, and to show the direct correlation between testing and positivity rate, in the last 2 weeks whenever they were testing more than 60,000, they were getting almost 3,000 as their positivity figure, 2,500 to 3,000 positive cases. But on Sunday, when they did only about 36,000 cases, their positivity fell to 1,800. So the center pointing out that one, mortality should be less than 1%, and two, that positivity rate should be less than 5%, and for both these they are also talking about a very good ambulance service and seamless kind of point to point management of patients.